difference. Even if you're not sure if someone has called for help yet, to still call.
You have real life emergencies, just imagine, God forbid, it's your relative or your person or whomever, you would want the best for them.
Kind of think about the lives that you did impact, the people that you were able to help. Wanting to make that much of a difference, that kind of just have to keep you going.
For more than 50 years, Doctors Hospital has been the leader and innovator of healthcare in the Bahamas. We are starting a new initiative, Air Ambulance Transport Services. Doctors Hospital Air Ambulance transports patients from any family island to our tertiary care center in Nassau or to any major health facility in the Caribbean and the U.S. Whether on land or in the air, we're Doctors Hospital, and we care.
Hello, everyone, and welcome to the Doctors Hospital podcast, where we connect public health issues to what we do here within the Doctors Hospital healthcare system. My name is Eddie Russell. I am the Learning and Development Specialist Supervisor of the GLOW Initiative, our hospital's wellness solution. And today I have three lovely ladies in studio today, and we are going to be talking about EMS Week. I want to start on my right. Just introduce yourself and tell us what your position is within the Doctors Hospital ETS space, and then we'll just go around the table.
All right. Hi, Eddie.
Hi.
Nice to meet you as well.
So good to see you.
My name is Lauriel Colebrooke, and I am an EMTB here at Doctors Hospital ETS Department.
All right, and to my left,
Hello.
it's your turn.
My name is Justine Metayer, and I'm a new paramedic here at Doctors Hospital.
All right, I know I have a question for you.
Good day. My name is Alexi, and I'm the supervisor here at Doctors Hospital ETS Department.
So I'm just going to jump straight in because as every time we have these podcasts, I always like to be taught things. What's the difference between a paramedic and what is the other thing? An EMT. Sorry. I could never ever understand like what the difference is, because I know there is a difference, because I know earlier we were talking about how people just call y'all ambulance drivers, as if y'all did not spend like all those months in school. tell us the difference, any one of you actually.
So we have 3 levels. So it's a EMTB, EMT meaning emergency medical technician,
Okay.
an advanced EMT, and a paramedic. And so the difference is basically the skills and the training level. So with an EMT, typically, most of our, I think we have about 32 EMTs employed at Doctors Hospital.
Oh, that's a lot.
So, right? So typically they're able to, it's basic, just as the name states. So they do transport, they're able to administer about 6 types of medication. And with the advanced EMT, that's when the training gets a bit more. They can do IVs, they're administering more medication. And then paramedic, which is the highest level of pre-hospital provider. The scope is significantly different. When you hear words like intubating and stuff like that, that's typically who would allow it. But even so, like I said, we have 32 EMTs at Doctors Hospital, but they operate as advanced EMTs technically because of the other kind of training and courses. We have them do IVs and ACLS and PALS and different courses.
So it's constantly upgrading. I would imagine it's
definitely.
constantly upgrading, and the industry kind of evolves as it goes along, right? I mean, so I would imagine that you are going on a call and it's very intense. Like, this is a high pressure job. I think anything in the medical field is like a high pressure job, right? What got y'all into this field, honestly?
Okay.
Because I love a high pressure job myself, but this is like life. This is like saving a life.
So for me personally, I always had to think for the healthcare field. I've actually been in the healthcare field for over 15 years now.
Wow.
I started off even like right after school working, getting my experience and what have you. And I always had to think for helping others. So, you can do that in many different forms, many different ways. And basically, we save lives. At least we try to save every life. But, but that's really what it is for me. The difference it makes, the feeling you get knowing that, hey, I can make a difference in this person's life. They can come inside your ambulance and they can be like on a scale of 1 to 10, they may be on a 10, but By the time you get to the emergency room, they might be at a 3, and they're giving you some sort of hope that, hey, you did something positive for me. So that's what it is for me.
Is it like 10 in pain or just 10 on like just emotion?
It can be emotions, it can be pain, whatever it is. Generally, as long as you see an improvement, you know you've done something.
Oh, nice. What about you? What brought you to the field?
Well, like Lauriel stated, I was always interested in the medical field, but not really sure what avenue to take or how to get started.
Mm-hmm.
So I actually started out during the pandemic. I was employed doing COVID testing at Doctor's Hospital.
Mm-hmm.
And, you know, I was trying to transition and phase out of that. And the EMT program came up and I enrolled, not really knowing what to expect really. But, you know, I went into it hopeful. And I think one of the most rewarding things about being a EMT and now a paramedic is, like L'Oreal said, being able to help people and knowing that you're making a difference. And even though you're walking into their private space, their home or their hotel room, wherever they are, you're meeting them where they at, you don't know them, but you still have to extend compassion and professionalism. And at the end of the day, know that, hey, I'm doing my best to help this person and they're getting the type of care that they need.
Lexi, how you got into this field? How did you get in here?
So it's an opportunity that presented itself. If I'm being honest, it wasn't nothing that I actually searched into. And so after I started to do the course and learn what it actually entailed, I just kind of fell in love with it. So I was like an EMT for about 5 years when I knew I wanted to do more for my patients. I wanted to help them more, give them a higher chance of survival. So that's why I kind of did my paramedic course. And just from there, I just kind of loved it.
What type of this is a question I always ask persons who are in the medical field. What type of personality you think makes for a good paramedic or I'm gonna start with you. If that's okay.
That's no problem. I think honestly and truly, I think the job itself kind of changes you. So you can come in it with all kind of different personalities, but just responding to these calls, seeing the kind of things that we do, knowing, okay, now I have to kind of wear my EMT or paramedic hat to treat this person. I have to get my mind a certain way. And you can honestly come in it with any kind of personality. And I think that eventually the job will kind of shape you to be able to do it effectively.
So it's kind of like a conditioning type of job.
Right. And to add to that, you know, we first time with those persons, you know, they're at their most vulnerable state. So of course, you know, they're basically putting their all into you. So if you weigh your emotions or your feelings on your shoulder, they're not going to be, you know, they're not going to confide in you to say, hey, you can help me. You can help me to feel better. So most times you come in, you may have a bad day or you may not be in the mood, but trust me, once you get to your patient and you see like, hey, like this person is relying on me, that changes everything. So for me, I wouldn't say any personalities or anything matter. But what I would say is that you've got to have some level of care for persons. Love what you do. Don't do it just for the money or anything. You have to have a heart in this field, you know.
I'd imagine like there requires a little bit of stoicism, like where you're just like things are coming at you, but you're just like, this is the front because this person's life has to be saved. Would you say that?
Yeah, because you have to be the calm in the storm.
Yeah.
Definitely.
Sometimes you'd come there and persons have relatives there, other persons, and everyone's being hysterical depending on what's going on. So you have to be the one to, you know, take command of the room, set the tone. You know, sometimes you may have too many persons there, you know, just give them something to do.
Control your scenes.
Yeah.
Definitely.
Your partner usually has your back as well. So definitely have to be level-headed, you know, take a deep breath before you walk in the door and don't get that tunnel vision and just expect anything.
I have this thing about taking control of the room, and I always tell people that it's not the patient that you're paying attention to. You have to pay attention to the patient, obviously, but it's everybody around the patient because they're the ones who can't seem to get it together, and rightfully so. I mean, I might not see you again after this incident, you know? So I always think that it's the people around the room, around the patient that has to, that you have to quell or calm and quiet down before you could actually do your job effectively.
You know what they teach me in EMT school?
What's that?
The loudest in the room, you always want to give them something to do.
Oh yes. Oh yes. Oh yes.
Yes.
Even if
Oh,
it's
yes.
just crying. Yeah, you can use them to control the rest. Tell them, okay, you want to keep everybody back and just give them something to do until they'll also feel like they're helping. You
Yeah,
know?
yeah.
So
I think
that
people just
works.
want to know what to do in that type of
Like, what can I do
situation.
to
Right,
help?
Find a
Yeah.
medication bottle for me.
It's under the drawer, under the bed.
Yeah, go ahead and get it.
Yeah.
So let's talk about. I know you said that there are 3 levels. Let's talk about schooling. Like, what does that require? And I'm asking this question because this is for my Bridge to the Future STEM students. What is schooling like? If you want to start from level 1 to level 3, what's that looking like? Any of you? Did any of you go to school? I'm only asking.
three of us. I guess we all had a different experience with the course.
Oh, please
for
tell me about
mine
it.
was intense. We had like a crash course, and it was during the pandemic.
Right.
So,
Oh,
of course, like
that hybrid learning.
hybrid, it was actually in person as well. We made it work. So
Oh.
that was, that's what made it even more like, okay, like you got to get this because you're ready around all of this that's going on. You ain't here to do anything but do your best and pass. So for me, it was quite intense, but it was also so good because we had 2 great instructors. We had supervisor
Thank
Alexi
you.
and Metayer. And thanks to them, they were able to pass on a lot of skills to us. And even at the end of the course, you're not going to always know everything, but as you go along, you grow and you learn from each other.
Yeah.
There's a skill I may know that she may not know. A skill she may know that I may not know. vice
So
versa.
it's all about
each one
synergy.
teach one.
Yeah.
Correct.
Tell me about. So I used to work in media. A lot of people don't know that. I guess why. That's why I'm behind this mic. I used to work in media, and I remember the very first car accident that I went on, and it was this little boy. He died in the process, and it was very, very sad. And I was just like, I don't know if this para me. So for your first code, like, what was that like? Any of you?
Let me go try because mine is from out of there.
That's a healing show as well, by the way.
While I was completing like my orientation rotations in the ER, we got this code come in of a lady, unresponsive or whatnot. CPR was already in progress, so they transferred her to the bed, and everyone was still pumping chest, and you get in line basically, and you take turns doing the compressions. There's someone doing the airway.
Mhm.
The doctor is there. There's all type of nurses. There's a respiratory therapist.
Sharing the load.
Yeah, people doing giving those drugs you need during the code and whatnot. But I was in line, and I think I did about 2 rounds of compressions. The lady was been doing it on her bare chest, and I think her ribs were already cracked at that point. But yeah, it wasn't like a lot of like recoil and stuff, and it was a very interesting scene because like when you're there, but you're not there. So it's kind of like an out of body experience. And she did not survive. So the person ended up, it wasn't a favorable outcome. So I think after that shift, I was kind of aloof or disconnected. And after a while, I started like having recurring dreams of seeing her in my dreams and stuff. Yeah, it was like that. So I ended up reaching out to my manager. And he set up counseling for me because we have those services here at work too. So I went to like 2 counseling sessions, and a lot of my coworkers reached out to me because I think they did notice the change. But yeah, the first one was the worst one. So after that, you kind of realize that even though we do give our best efforts and we are trained to do this, sometimes it just is what it is, and it's not always a favorable outcome medically wise. So just knowing that you did your best during the code and, learning to debrief around people who understand what you're going through, it helps a lot. And the support was definitely there.
How do you, and this again is for everyone, how do you continue after that? Because I know at some point there would have been where the outcome wasn't favorable for maybe all of the paramedics or the EMTs? Like how do you move on and stay in the field? Because I nearly didn't after that one because I was like, I'm almost certain that this isn't going to be. I'm almost certain that this isn't going to be the only car accident I see, a traumatic one as well. How do you kind of bounce back from that?
I think for me personally, because I did have some calls, and I would even use the word gruesome. It's just like she said, after you get support, is having that in the back of your head that, okay, if I stop today, like I still want to help more people, you know.
Mm.
Unfortunately, I was not able to help this person, but you kind of think about the lives that you did impact, the people that you were able to help. So it's still wanting to make that much of a difference that kind of just have to keep you going.
So it's just kind of like just knowing that this is just one. Not that this is just unfortunately is the number, but yeah, that sounds.
Sometimes you're gonna lose some, and sometimes you're gonna save some, and that's the reality of it. Not to sound harsh or anything, but that's why you have to have a good support system, and that we have within the department.
So tell me about like teamwork. Like how is that? How does that make a critical difference in like the way that you do your jobs?
During every call, teamwork is required. That's why we always work in either pairs of two or luckily sometimes pairs of three. You're going to need assistance with lifting. You're going to need assistance with, even the BLS stuff. You have someone putting the person on the monitor, someone doing assessment. Like we said earlier, someone telling the relative, hey, can you go find an ID or can you do this or can you do that? Sometimes you go on scenes, you may need additional assistance. Hi, sir, ma'am, can you help us assist with lifting or, things like that. But teamwork is definitely needed. There's no I in team, and there's nothing in this department that we can do on our own when it comes to patient care.
Anyone else want to chime in on that?
So to kind of piggyback on what Lauriel said, when you think about teamwork, that question is quite fitting considering this year's theme, which is improving outcomes together. It's not just me and my partner, whoever I'm working with that day. It's the entire chain of survival. So it starts with the caller. You understand me? It starts with the caller and the dispatcher giving all of that pre-arrival instructions. And then it's us getting there and then even transfer to definitive care within the emergency room. So all of that is actually considered teamwork. In healthcare, like she said, no one works by themselves.
I think when I think about the care team, you called it earlier. Was it the chain of
survival?
Chain of survival. What is the chain of survival?
Chain of survival in a nutshell, it's like I said before, it's starting with that call. That initial call is where it all starts. And whoever is there, let's say, even if they are highly trained professional, knowing to start to get the defibrillator, your hands is actually on this person's chest if they need compression starting. It's the ambulance crews arriving there and just beginning that advanced life support to them, and then us carrying them to the hospital. It's the hospital doing their part, and then it ends. Well, actually, it used to end when the patient goes to ICU, but now it's one step further. It's actually when the patient is in recovery, go into rehab afterwards and all of that stuff.
So I put in something in there?
You may.
Chain of survival. The first point was you said the incident happening and someone calling for help. I think that's one of the most crucial parts of the chain of survival. Because, we live in a social media area where people want to pull out their cell phones first to record.
Right.
It's just a plea to the public. Something happens, even if you're not sure if someone has called for help yet, it would still be in your best interest to still call, So we don't want someone to just be incapacitated to some degree and they're not receiving the care that they need promptly because that initial call wasn't made. So I feel like, if we,
So plea is before you record, dial, call first, and then record if that's what you could do.
I didn't say that, but
they can do it anyway.
And even with that being said, because like she said, it's not only calling to make sure that this ambulance is en route. It's our dispatchers actually telling you, okay, this patient is bleeding out. Let me walk you through how you're going to help to slow down this bleeding until these paramedics or EMTs arrive.
Every second is crucial.
Right.
In patient care.
So I have a question regarding, let's say, for instance, I'm walking on the road, I'm going about my business, and somebody passes out in front of me. Or, they cut themselves or something to that effect. Is there a first kind of step protocol that a random Joe should do after calling to try and help and save a life until you all get there? Is there a thing?
Yes. So, well, I think the first scenario you gave was someone passing out or collapsing.
Right.
So, if they're not conscious, you want to make sure first and foremost that you want to verify their breathing and that they have a pulse. Those two things are present. It's not really much you can do at that point, except for call. But if they're not present, yeah, you call for help. And if you don't have a pulse, you can start compressions only CPR, which means you're putting your two hands in the middle of their chest and you're pumping the chest at a rate of 100 to 120 beats per minute. So while you're on the phone or someone else is on the phone calling for help, you can get that started and try and improve the outcome if possible.
So that's
And
like that would be BLS.
sorry.
No, please. I'm sorry.
Yes, I was about to say, and that's why it's so important. We try to encourage persons to at least learn basic life-saving skills, something that's offered here at Doctors Hospital IOL department, and I think you mentioned something about bleeding. We try to see if we can train persons to know how to stop the bleed. It's something that's also being offered by NIMS, by PHA on Thursday. I think we have it right, Alexi?
Yeah, in collaboration with
In
us at
collaborate,
PHA Academy.
right.
Oh, lovely.
So yeah, it's good to know basic skills like that, how to do compressions or how to stop the bleed if need be until help is there on scene with you.
So just kind of switching gears, what do you think is one thing that people won't ever realize about an EMS professional?
They always think we're just ambulance drivers.
What does
I
that
just
even
had
mean?
to say it anyway. They
So they don't
always
think
think
you're equipped.
no matter the level that you are, whether it's EMT, AMT, or a paramedic, they think, hey, the ambulance driver just arrived. Like, it's more to that. Like, we're literally in the back there doing everything we can from pre-hospital care up until we get in the actual hospital setting.
Is there something is there like apart from that you just being an ambulance driver, is there some sort of thing you want as they refer to you as, because we know better, is there something that you would want the public to know when an ambulance EMS professional comes on the scene? Like what is that thing that everybody would want, y'all would want them to know in order to conduct
I'll
themselves?
start with prior to the scene, going to the scene. Just kind of, excuses, move out of the way. Let's start there. Because a lot of persons also do not respect the ambulance. And, we have real life emergencies. Just imagine, God forbid, it's your relative or your person or whomever, you would want the best for them.
Mhm.
Treat every person the same. So, like we said earlier, every second, minute, everything counts. It's very crucial. Once we get there, the best we can say is try to clear the scene, stay calm,
Mhm.
because we want to get in there and do what we can, but at our best. But if you hovering over us or if you hear yelling at us and everything, it's not going to help the situation. So if everyone can remain calm and, just comply and assist us the best way possible, things will be good.
Awesome. When y'all on the scenes, how do y'all stay calm? Because you just said sometimes people are like yelling and they're like in your face and they're trying to be involved, not knowing that they're actually doing harm than good. Like how do you stay calm on those scenes in those high pressure emergencies?
You just gotta remember not to stay tunnel vision. No tunnel vision. Just remember the goal as to why you're here and what you are going to do. And trust me, once you see the patient, everything will just flow. And then once you have your partner there, something you may not catch, your partner may catch, and you're gonna make it happen.
And I think training and experience helps. Knowing, okay, I'm equipped with this knowledge. And then when you start to kind of do it, the more years you have in the game,
It just flows.
yeah.
It just becomes like this natural. Is it like riding a bike? Would you say?
Not right.
I wouldn't say that. Because I used to know how to ride a bike, but now I don't know what happened. So it's definitely not like that.
You don't know how to ride a bike, but you can save a life.
Definitely. That's all that matters.
Fair.
What's one of the most rewarding parts of being in this field? Actually, would you say?
One of the most rewarding parts.
Mm-hmm.
I'd have to say when either a patient or the relative comes to you after the fact and they tell you thank you, or they
Oh,
shake your
it's the
hand,
That's such
gratitude.
a
they ask for
rewarding
a hug
feeling.
or whatever
Yeah.
it is. You just know that, hey, I was here when you needed me and I did what I could in the best way I can. And just to know that, what you did was appreciated and that you were able to help someone, in their moment of need. So it's very rewarding, I'd say.
So I agree with what Justine said, but even besides that, it's just my colleagues just talking to each other after the call. Even if it's as simple as talking, them telling me, "Oh, you did a good job with that IV," or something simple as that. I think all of that kind of helps. But this entire field, just knowing, even deep down, that I tried and I saw a favorable outcome. Because I mean, like she said, you can't always predict that. That's kind of rewarding for me.
I like the teamwork that you enjoy so well.
It's a special bond we have here.
Yeah.
It's like, I never work at a place where, everyone just get you without you having to over explain or, because everyone has that common experience. So,
And everyone is
Yeah.
always willing to help. Like if you get dispatched to RT or something, the next crew will be there. Like y'all need us to come. Y'all need backup. Like everyone is just always ready to assist, and I love that.
Is it like an adrenaline rush that makes y'all kind of like want to just like get in and
Especially the nature of the call.
yeah?
Definitely.
The trauma ones that we don't get quite often.
Yes.
We have
Like
some
everybody's
trauma
just like, ooh, trauma.
Yeah. Like trauma.
Is it
like,
that?
You hear that and
Yeah.
it's like, let's go. Like, it's
Oh,
time to ride.
goodness.
Yeah.
So when y'all get, let's say you pick up someone, you're doing all the work and then you get to the hospital. Who are the first people that you see once you get to the hospital? And what does the team look like in total?
So it actually would depend on the nature of the call. So if it's just a typical call, then the first person will obviously be like the nurse and the PCD. They'll kind of be waiting bedside to take over the patient care. But unfortunately, if you have like a code or something, then the entire ACLS team, will meet you. Sometimes they even meet us on the ambulance round.
Wow.
Yeah, it's always all hands on deck.
So if somebody was considering being in this field, what advice would you give them?
Okay, I would tell them to do it. Even at Doctor's Hospital right now, we're currently hiring. Try out there. So yeah, we just need more people in this field. It's continued, like we're expanding, we're growing, and we need all the help we can get. And it's a good field. It's a rewarding one.
Great.
And we offer courses here at IOL. So if they wanted to know how to actually start to get into this field, so.
And IOL stands for the Institute of Learning, our external training body within the Doctor's Hospital healthcare system. So y'all know I love talking about self-care. And I heard that earlier, Justine was talking about she was talking about just needing, like, she had a moment, right? How do you take care of yourself? And, in self-care or just in wellness, there are 8 dimensions. There's physical, mental, emotional, spiritual, environmental, professional, financial, social. And then, so physically, how do you stay fit? And then mentally, what do you do to kind of stay grounded? Because this is a career that, or field that requires you to stay grounded. You have to be grounded to deal with people. You can't be kind of spazzing out. How do you do that?
All right, you're looking at me.
Yeah.
So I'm the winner.
Chicken
So
dinner.
for me, I'll start off by saying that my middle name is Airplane. So when it comes to mentally, for me, once I take a trip, I have mental freedom. Like I love traveling. That's what I do. That, helps to keep my mind sane. I actually just came off of a plane yesterday. So yeah. Physically though, I try my best. Well, in this department, I'll be honest, it's hard to stay on a strict diet.
Yeah.
Because sometimes, we work overnight, sometimes we need a quick bite, and sometimes a quick bite may be asotucky or something. And sometimes it's hard, to keep the strict diet. But I try to have a balanced diet on off days. You want to rest, but I try to do the gym as well. So you do small things here and there. You do what makes whatever works, to be honest. But the reality of it too, we also kind of stay physically fit in the field because we're constantly lifting patients and stuff. So
Mhm.
some way, somehow, you're gonna be fit.
Yeah. Because I worked in rehab, I'm always concerned about ergonomics and body movements and how we lift and all of that. So I'm just curious as to how, again, physically, you stay fit.
Thank you.
What's the biggest lesson EMS has taught you about life and people? I think this is a really good one.
Expect the unexpected.
Say more.
Or well, like you say, we're trained to do things a certain way. We have protocols and procedures that we fall back on. But at the end of the day, you still use your discretion. And whether it's people around you or the patient or your family or friends or whatever, um, you always have to have patience. You always have to have a listening ear. And you always have to be aware and be mindful of things that are going on around you and try your best not to have, a hyper focus or a tunnel vision because there's usually something you're going to miss and it might be at the end of the day very crucial. So I'd say, yeah, expect what you didn't expect.
Yeah.
I think the biggest lesson for me is just life is short, You never know when it's going to be your last day. So it's just surround yourself with people you love. Always bring that energy. Remember to tell people that you love them. You know what I mean? Because we go for people in all kind of environments, and all of our patients, it's not like they had some terminal illness. You just never know when something's going to happen.
Yeah, it's something to think about when you said to love people, because I mean that's something we should do every day, right?
Yeah, some of us take it for granted, and
Really
we
do
have
take
to
it for
remember not to.
I think when you witnessed the slipping away of life and how quickly it happens, I think you have a deeper appreciation for the people around you. So I love all of y'all. So we're talking really about EMS week and the people in the back, our producers. So we're talking about EMS week. Tell us what message you would like the public to know about the upcoming weeks and events that you're gonna have. I see we have the EMS Transport Services banner up, flying high within the studio, and I know there are a lot of things coming up. And I want to compliment your department because y'all seem to be the forerunners of every like truly meaningful outreach event within the Doctor's Hospital. So it's obviously next to Glow. But y'all have been doing this for a very, very long time. And what I love about the energy that y'all bring to it is it's so genuine and authentic. It doesn't seem as if y'all do this for any sort of glitz, glamour, or recognition. Y'all just do it. And I want to know, in addition to the other things that's going to be happening in the coming week, what is that about? As the director of all of the outreach initiatives, Lauriel. Lauriel doesn't like to be recognized for this great task that she does. I heard her name before I even knew who she was or how she looked, because she was always the name being called in the rooms about giving back. And I know it's a lot of other persons within the space, so I don't want to overshadow them, but tell us about the outreach initiatives.
Okay, so tomorrow, I'm very actually excited about it. Tomorrow we will be going to the Children's Emergency Hostel. And sometimes we have homes within the entire Bahamas that are overlooked. Not saying that person doesn't, assist or anything, but we decided to choose them this year to do a giveaway or a give back, I should say. So we're going to be giving toiletries and snacks to the home. And then we asked the home to send us a list of each individual that resides at the home. And each person in ATS was assigned a person. So we all gave personal gifts and, the outpour of love and donations and, the excitement from everyone. Like, it's already warming my heart so much. So I'm looking forward to that. So tomorrow at 4:30 p.m., while it's not open to the public, because of course, the privacy of the kids and everything, we're going to go there, put a smile on their face, do some interactions with them, meet our person, maybe show them the ambulance and do one or two things
Oh,
with
that's
them.
amazing.
And, encourage the staff to continue what they're doing, and show them for ETS, we go above and beyond the call. It's not just about us going out there, picking up persons from their home or from the hospital and doing the transport, but we also, want to make ourselves more visible within the community. Sorry.
Yeah, that's what glowing is all about, by the way.
Yeah. We're also on the Glow in Doctors Hospital. Thanks, Eddie.
You're welcome. My pleasure. What else are you guys doing?
So for EMS week, we have to remember two things. So one is try to inform the public about us, about what we do, about how they can help. And another one is recognizing our staff.
Right.
So like Lauriel said, so that's what we have planned for Wednesday. On Thursday, we're going to assist PHA and EMS department. And we're going to do a stop the bleed to, like we said earlier, just help some people on knowing what to do if they were put in that position. And then on Friday, we have our departmental social. We got gifts for all of y'all. And just recognizing them to let them know, like, we see y'all. We see everything that y'all do. We do appreciate y'all here at Doctors Hospital. And then on Saturday, we have a Zumba schedule, and that's actually extended to all EMS providers in Nassau. And then we have like a friendly competition with NEMS. And I think they said like Superior Care in the evening. That's about like 1:00. So very excited for that, actually.
Y'all better win.
I agree.
I hope so. Let's go, ETS.
Let's don't play around. Thank you all so much for being on the podcast today. I'm really looking forward to seeing what y'all have in store. I know that the public is probably going to be more receptive. They may be in your way, but maybe they'll support. I definitely hope that they support y'all in this week that's upcoming. Do y'all have any final words? Anything you want to say to the public? Anything you want to say about your profession? Any shout outs that y'all want to give to anybody?
I guess I'll start. I think first and foremost, just if you see something happen, like we said before, the first thing you want to go ahead and do is either dial 911 or our number, which is 302-4747. Because even if you don't know what to do personally, our dispatchers will advise you on the best way to go and know that the care that this patient needs is actually on the way.
That's it for you?
Yes.
Lauriel, you want to say anything?
For me, I guess it's for our bridge students and anyone else considering, a career, whether it's with Doctors Hospital, PHA, or wherever, that, it is a rewarding feel. It's not something we take for granted at all, The life you save today may very well be your own. That's how I look at it.
And last but not least.
Happy EMS week to all the EMS providers out there. We have some Nassau, Freeport. We have some in the islands too. Wherever y'all working, y'all continue to be encouraged. Continue to take care of yourselves. If y'all don't, you won't be able to take care of anyone else. So just know that you're loved and you're appreciated, and the work you do, even though most times it's unseen by the public, it's not unappreciated.
I think that's a truly beautiful note to end on. So thank you all for being here. I'm really looking forward. I might come out on Saturday. It's at 6. Okay, so the pressure's on. All right. So on behalf of myself, my producers, Gally, Johnny, and Priestley, the dream team in the back. Thank you all so much for paying attention and sticking with us for this podcast. Stay tuned, where we at Doctors Hospital provide the best care now in all the spaces that we occupy. Have a good one.
Good health starts with easy access, and that's what LAMP gives you. Affordable, reliable entry to high-quality care designed to help you stay well. With LAMP, your health journey is simplified, from routine labs and imaging to pharmacy services, urgent care, and beyond, all within the Doctors Hospital health system. With plans starting at just $1.30 per day, LAMP is your guide to wellness and peace of mind for you and your family. Visit lamp.doctorshorse.com to learn more.